Three, two, one, and here Dr. Z here. So I'm going to give you a little bit overview of the coronavirus 19, some of my experience with it, what's been going on, where we are, and where we're going. So the first thing is you know, in history, have we experienced something like this? Absolutely. We've experienced worse things. Look at the Black Death. 200 million people have died or died from the Black Death. In terms of the Spanish flu, 40 to 50 million. And we are now in the COVID-19, 60,000 people at the time that they did this graphic. But of course, we've overcome that way more. So can we overcome this as a humanity? Absolutely. This is not an existential threat, but it is definitely something that is going to cause us a lot of pain. And as you can see, it's put the world in a different state. And so in terms of the diagnosis, how do you diagnose this as a whole world? It goes from an endemic to an epidemic to a pandemic, and that's what we are right now, is a pandemic, as you've heard that term before. And the World Health Organization is the one that makes that determination. They did take a little bit longer than what they needed to, but of course it's easy for me to say because I'm not the one making that decision. But they put a lot of pressure, so other countries put a lot of pressure into the World Health Organization not to make that determination, because of course it impacts trade and many other things. Diagnosis in the US, it was lagging behind. I remember back in February I wanted to test a patient and I couldn't, because that patient had not been in Wuhan, China. It was a part of the CDC regulations not to test these patients. And then, frustrated with this, the states started saying like, hey, we need to test more people and make our own test. And so the FDA passed and said, look, just fill out an emergency use authorization. And so they started doing this, but things started happening so fast that in February 29, they started letting the states actually test by themselves. And in March 3rd, that's when the Vice President Pence said, look, let's remove all of the limitations. And now it is at the discretion of the doctors. So I remember that because it was easier now for me to test, even though the tests were still taking like 7 days. So how do we test this? We actually use a test called PCR. I used these tests when I was actually doing research. Back in the day, I used to do research in acute respiratory distress syndrome, some of the same things that happen here with COVID-19. And we used to test genes and gene therapies into patients that were going through this. But one of these tests takes about 48 hours in the lab. In a commercial lab, is easier because everything is streamlined and you have everything you need, the samples, everything. And so that's what it takes. But now the new tests that came out are very faster. They're a lot faster. And so I'm so excited to see this. Really amazing how this country reacts and how these tests can come up so quickly in other countries and other industries. In terms of the labs that we do in the hospital that we're seeing with COVID-19 patients are leukopenia, which that means the cells that fight infection are actually low. That could be because either the virus shuts down the marrow or because they use it really fast. Those are the cells that fight infection. We see problems in their kidneys, increased BUN and creatinine. We see inflammatory markers go up, such as D-dimer, CRP, LDH, interleukin 6, ferritin, all of those. And we see opacities in the lungs. We see ground glass opacities. We see some of these opacities when people have fluid overload, when they have heart failure. With the COVID-19 patients, we see it because their lungs become so leaky that almost the fluid from the body leaks into the blood and people start drowning, which is really tough. And so that's why they have to be put on ventilators. So in terms of treatment, I'll talk about that in a little bit. And right now, this is the current status of this virus. About 80,000 people and 1 million deaths, which is a pretty crazy number. But actually, when I looked at these numbers initially, I saw that there was going to be, according to artificial intelligence models, could be about 1 billion people infected, which is pretty crazy. So thankfully, it's not as bad as it was initially thought. And hopefully we start continue to see the trends, even though it's such a crazy disease. Just imagine, like when I did those videos at the beginning, like those numbers, I couldn't even like wrap my head around how much that would be, which would be like a lot of millions of people dying. And so thankfully these numbers are horrible, but they are not so bad as we thought. And so in terms of treatment, there is no treatment that kills the COVID-19. There is no treatment. For instance, for staph, or for infections in the skin, we can test the bacteria, and we can put it in a petri dish, and then we can throw it antibiotics and see what kills it. For COVID-19, we cannot do that. And so there is no treatment for it. Yes, there is things that you can do to improve your fitness, but there is actually no treatment for COVID-19. How do you treat it? Well, you can go from a top to bottom approach, or from a bottom to top approach. From a In terms of a model, like if you look at a model that says, okay, how do I treat this disease? This is all the things that, if you and I were going to create a model right now, these are all the things that we would have to put into the computer for the computer to spit out a number. And as you can see right there, we do have behavior risk, the R naught, which is how many people you can give this virus to if you were infected, and the behavior of the people. And so it's really important to look at this, because yes, it does make an impact what we do. It does make a huge impact. So very important for people to realize that we are making a difference. Now, there is no treatment for it. So what do? If people get really sick, we put them on this machine, either a BiPAP machine, which is actually not recommended so much because of the virus can be thrown into the air and more people get infected. And so what's recommended actually is to go ahead and intubate these patients or put them on life support. And this is so important. And this is what a life support machine looks like. We put people under general anesthesia and put them on life support. In terms of people who are in the healthcare industry, who understand a little bit about that, and those of you who are interested, there is a low threshold to put people, meaning that you put people faster on these life support machines, because we know that this disease is very aggressive, and we just go ahead and put them in. In other people, we would wait because we know what those diseases act like. For instance, people who have COPD and things like that, but with the virus, you want to make sure you put them on the life support machine faster. You want to make sure you're using protective equipment, high I mean, you want to make sure you do that, right? High importance in your mind as a practitioner to have that. Um, Use rapid sequence intubation, which is just means, give them the specific drugs to slow the patient into that intubation so that it goes smooth. Use the camera, the gyroscope, unless you're super comfortable with not doing it without it, like many emergency room doctors are, and many other doctors are. Do the recommendation is to use the video camera just so that it goes quicker and smoother every single time. And you put patients in acute respiratory distress syndrome protocols, which improves the how well they do with this. So that's in terms of the treatment. In terms of or what are the risks, who is at the most risk? Well, we know that the people who are the most stressed, meaning heart disease, age, chronic respiratory disease, diabetes, hypertension, cancer, those are the patients who are dying most. You can see here that after 60 years old and above, that's when the high number goes up. But remember, physical age and genealogical age are different because they act in our risk factors. So if you can get your physiological age to be lower than your genealogical age, you are making improvements. So you can always do that. Now, in terms of what diseases are the hardest hit, cardiovascular diseases and diabetes are the hardest hit. Chronic respiratory diseases, hypertension, and cancer. Pretty crazy. Some of these diseases, like cardiovascular disease and diabetes, can be reversed in many people. And so that's what I talk about a lot. If you have any questions about how to reverse heart disease and diabetes, and when can you do it and when can you not, and how to do it safely, definitely we have definitely more information on that. And the other thing is that for some reason is hitting more male than females, um, almost double, which is pretty interesting, but they don't know why yet. Most of these people expect about 8 days on the ICU and 7 days medium ICU to death is 7 days. Those who die is very critical disease, very fast. In terms of can we do nutrition, right? All these people ask me about nutrition. Does it help? So the way I look at nutrition is a little bit different. I look at primary, secondary, and foundational nutrition. The primary nutrition is physical health, community, social, financial, and your career. Why does this? Why do I think? I don't think whether this works or not. This is science that shows that these markers actually can make you live longer. These markers could make you sicker. Like if your physical health, your financial health, your social health, if those are not at a high score, you actually have highest risk of death and mortality. So it's not that I think about this, is that this is actually the data that has been accumulated over 150 countries that shows us that these five factors can improve our resiliency to anything, to other diseases and to things like what's happening in the world right now. Now, secondary nutrition, of course, there is food and super nutrients that you can put into your body that improve your immune system. I don't know if it happens against the coronavirus. We don't know that yet, but there are studies that show that if you put people in IV vitamin C in the ICU, they spend shorter times in the ventilator. There are studies that say if you increase certain amount of ginger and turmeric and all of this in your diet, that you have less likelihood of getting colds and viral infections. And but does it help to the coronavirus? There is no study that shows that. So for anybody to say that is irresponsible. There is no studies that show that. So that is what it is with nutrition. Now, the next thing is, hey, what is next, right? And so these are some of the estimates that show that in about 12 days we should see the peak, and in about August we should start seeing the resolution of this issue, that we're in about an 87,000 ICU 19,000 ICU shortage beds and about 80,000 shortage of regular hospital beds. Now, that is like the best case scenario, I think, because the numbers are showing us a lot different. But this shows that about 40, uh, I would say it's about 45,000. I mean, it's just too early, I think. I think once Italy resolves, we're going to be able to say, but I would say we're going to be at the top of this curve or somewhere in between the middle and the top. Hopefully not, hopefully things get better. And as you can see here, the death lags because a lot of these people, once the cases, no new cases, right? They say new cases coming to the hospital, new cases coming to the hospital, and then deaths start rising, new cases start dropping, right? Still, you have people in ventilators for about 10 days. Still, people are going to be dying. So that's going to lag behind. That's why you're still in August. We're still dealing with this. So this is not going to go away in a week or two. This is going to be something that the world is going to be dealing with into August, September. Even when you look at the plans of the CDC, the whole plan, one of the assumptions is that hey, this will take 18 months. That's what their assumption in their models are. That almost like the worst case scenario. That way they're planning for everything, right? So what's next? To test, to treat, to prevent, right? And most of the work doing this, Bill Gates have been amazing at helping the world go through this. And so test, treat, and prevent. And the last thing is like, hey, never give in, never in nothing great or small or pretty, never give in except to convictions of honor and good sense, never yield to force, never yield to the apparently overwhelming might of the enemy. I love Winston Churchill because this guy was like almost dying with his whole country as the war was coming upon them. And even then he grasped into like being able to stay strong and continue, never give in. We got this, we're gonna get through this together, and just stay in there and focus on what's working for you, focus on the most important things. Dr. Z here, take it easy.